Sphenoid bone, which is colored yellow in color, is an unpaired cranial bone. Its body is located in the middle cranial fossa. Its greater wing is also located in the middle cranial fossa. It is in the shape of bat, having two greater wings and two lesser wings. Lesser wings are located in the anterior cranial fossa. It has seven parts: a central body, two greater wings, two lesser wings, two pterygoid process. Body is cuboidal in shape, having six surfaces: superior surface, inferior surface, anterior, posterior, and two lateral surfaces. Superior surface presents a groove called as sulcus chiasmatis, which lodges the optic chiasma formed by the union of two optic nerves. Superior surface presents a hypophyseal fossa for the pituitary gland. Hypophyseal fossa is anteriorly bounded by a elevation called as tuberculum sellae. Posteriorly, it is bounded by another elevation called as dorsum sellae. To the tuberculum cell and dorsum cell, a fold of dura mater is attached called as diaphragmatic cell. Dorsum cell presents two elevations in the sides called as posterior clinoid process to which the tentorium cerebelli is attached. Posterior part of the superior surface along with the superior surface of the basilar part of occipital bone forms the clivus where the brain stem rests. Anterior surface of the body presents a crust called as sphenoidal crust which articulates with the perpendicular plate of the ethmoid bone. Anterior surface completes the posterior wall of the labyrinth as well as it forms the roof of the nasal cavity. On both the sides of the sphenoidal crust, the anterior surface presents the opening of the sphenoidal air sinus, which communicates to the sphenoethmoidal recess into the superior meatus. Lateral surface presents a carotid sulcus which lies between foramen lacerum and superior orbital fissure. It lodges the internal carotid artery. Lateral surface of the body is related with the cavernous sinus formed by the meningeal layer and the endocrinial layer of the dura mater. In between the two layers, the oculomotor nerve, trochlear nerve, abducent nerve, and the ophthalmic division of the trigeminal nerve passes from the cranial cavity into the orbital cavity. Posterior surface of the body articulates with the anterior surface of the basilar part of the occipital bone. Inferior surface presents a projection called as rostrum which articulates with the ala of Omar forming a spondylosis type of joint. The greater wing has three surfaces. The superior cerebral surface, which forms the part of the middle cranial fossa, the lateral temporal surface, which forms the temporal fossa, and the inferior orbital surface, which forms the lateral wall of the orbit. Superior surface has three foramina: foramina rotundum, foramina ovale, and foramina spinosum. Foramina rotundum transmits maxillary division of trigeminal nerve. Foramina ovale transmits the mandibular division of trigeminal nerve. Foramina spinosum transmits the middle meningeal artery. Lateral surface is divided into temporal fossa and infratemporal fossa by a crust called as infratemporal crust. The infratemporal surface presents a spine called as the spine of the sphenoid bone near the foramina spinosum. The infratemporal fossa presents the lower openings of the foramina ovale and foramina spinosum. Temporal fossa gives origin to temporalis muscle. The infratemporal fossa gives origin to the lateral pterygoid muscle. The spine of the sphenoid bone gives attachment to the sphenomandibular ligament which extends from the spine to the lingula of mandible. From the foramina ovale, mandibular division of trigeminal nerve emerges out. From the foramina spinosum, middle meningeal artery, a branch of maxillary artery, enters in. Lesser wing has two surfaces, a inferior surface which forms the roof of the orbital cavity and a superior surface which forms the part of anterior cranial fossa. Inferior surface gives attachment to levator palpebrae superioris. Lesser wing has two borders. Anterior border articulates with the orbital plate of the frontal bone, and the posterior border, which is free in the medial end, forms a anterior clinoid process. Anterior clinoid process gives attachment to the free border of tentorium cerebelli. Lesser wing is attached to the body by two roots. In between the two roots, there is optic canal. Optic canal transmits the optic nerve and the ophthalmic artery, a branch of internal carotid artery. Superior orbital fissure is a slit-like opening bounded by superiorly the lesser wing of sphenoid bone, inferiorly the greater wing of sphenoid bone, and medially the body of sphenoid bone. Superior orbital fissure transmits the superior division of the oculomotor nerve, inferior division of the oculomotor nerve, the trochlear nerve, the abducent nerve, the branches of the ophthalmic division of trigeminal nerve, mainly the frontal nerve, lacrimal nerve, and the nasociliary nerve, and the lacrimal artery. Also transmits superior ophthalmic vein and inferior ophthalmic vein. At the junction of the body and the lateral surface of the greater wing, there are two processes called as pterygoid process. Each pterygoid process has two plates. One, the medial pterygoid plate, and another is the lateral pterygoid plate. In between the medial pterygoid plate and lateral pterygoid plate, there is a fossa called as pterygoid fossa. Posterior border of medial pterygoid plate presents a hook-like projection called as pterygoid hamulus, to which pterygomandibular raphe is attached. Posterior border of the medial pterygoid plate and the pterygomandibular raphe gives attachment to the pharyngobasilar fascia and the superior constrictor of pharynx. Pterygoid fossa gives attachment to the medial pterygoid muscle. Pterygoid fossa also gives origin to tensor veli palatini. Lateral surface of the lateral pterygoid plate gives origin to the lateral pterygoid muscle.